Picture this. A surgeon drills a hole into your skull. There is no anesthesia, there are no antibiotics, and the tools being used are made of stone or bronze. This is happening 7,000 years ago, long before the dawn of modern germ theory or advanced biology. Does it sound like a death sentence? To many of us today, it certainly does. Yet, the reality uncovered by archaeologists is far more complex and surprising. Many of those patients did not just survive, they thrived, and they were far from alone in their journey toward healing. We often imagine ancient times as a chaotic and primitive era, especially when our thoughts turn to the realm of medicine. In our collective imagination, we see images of crude tools, superstitious chanting, and incredibly high mortality rates where even a small scratch could mean the end. We assume that before the 1900s, human health was a desperate gamble against nature, but archaeological evidence tells a completely different story. A story of sophistication, observation, and an undeniable mastery of the human body. We see ancient surgeons performing brain operations with astonishing precision that rivals some modern techniques. We see doctors removing cataracts and restoring sight to the blind during an age when most of the world did not even understand how the eye functioned as an organ. Today, you will discover 3 examples of ancient medical success that continue to surprise even the most experienced modern physicians, and you will learn what we are still taking away from these ancient techniques in the present day. Let us start with the most dramatic and perhaps most misunderstood example, trepanation. This procedure involves removing a piece of the skull bone, either by drilling, sawing, or carefully scraping it away to expose the protective membrane of the brain. To a modern observer, this sounds like an act of extreme violence or perhaps a desperate ritual, but research shows it was a calculated medical intervention. This was not a rare or isolated practice, far from it. Archaeologists have discovered over 1,000 of these skulls across the globe, from the rural valleys of France to the high peaks of Peru, spanning from the Stone Age all the way through to the height of the Great Inca Empire. It was a global phenomenon that lasted for millennia. Now, here is the big question. How do we know these people actually survived such a terrifying procedure? The proof is written permanently in the bone itself. What hours a patient dies immediately or shortly after surgery, the edges of the bone at the surgical site remain sharp, jagged and raw. But many of these skulls show something completely different: smooth, rounded edges and a closing of the porous bone structure. This is clear evidence of new bone growth, a biological process called remodeling. This process only happens if the patient lived for weeks, months, or even many years after the operation. Some skulls even show multiple healed operations, indicating that the procedure was performed more than once on the same person. In one remarkable case from South America, an individual was operated on 2, 3, and in one truly incredible instance, 5 separate times. Each hole showed significant healing, proving the patient survived every single one of those surgeries. We have to wonder, what hours did they do it? What hours could possibly drive a society to perform such high-stakes surgery? The primary reasons were likely very practical. In a world of tribal warfare and manual labour, skull injuries from accidents or combat were common. What hours a heavy blow strikes the head, the brain swells. Because the skull is a closed container, that swelling creates immense pressure that can lead to seizures, coma, or death. Ancient surgeons realised that by removing a piece of the bone, they could let the pressure out. This is a logic that modern neurosurgeons still use today in cases of traumatic brain injury. Ancient texts, including those from the famous Greek physician Hippocrates, even mention trepanation as a treatment for what they called the falling sickness, which we know today as epilepsy. What hours? Some cases discovered by archaeologists were likely ritualistic or related to spiritual beliefs. The vast majority of medical applications are very well documented through the patterns of fractures found near the surgical holes. The techniques involved were varied and showed a deep understanding of materials. Some cultures used scraping, removing the bone layer by layer with a sharp stone like a carpenter thinning a piece of wood. Others used drilling, making multiple small holes in a circular pattern and then carefully breaking out the center piece. In ancient Peru, Sawing a rectangular opening was common, requiring 4 precise cuts that met at the corners. Finally, there was circular cutting, carving a deep groove and lifting out the bone disc like a lid. The tools may seem primitive at first glance, obsidian blades, flint saws, or bronze tumis. But here is the surprise. Modern research shows that obsidian can be significantly sharper than modern surgical steel. Because obsidian is a volcanic glass, it can be flaked down to an edge that is only molecules thick, allowing for a cleaner cut that causes less trauma to the surrounding tissue. What oursin? We look at the statistics. The results are staggering. In ancient Peru, surgeons achieved healing rates of 60 to 75%. Think about that for a moment. In an era without modern disinfection, heart monitors, or chemical painkillers, 3 out of 4 patients survived having a hole bored into their skull. That is a success rate that many European hospitals in the 1800s would have envied. Now, for a quick reality check. We must acknowledge that we mostly see the successes because patients who died immediately left fewer traces of healing on their bones. The true numbers of total attempts were likely lower, but even if only half of the operations succeeded, that remains an extraordinary achievement for the human race thousands of years ago. It suggests a level of post-operative care and infection control that we are only beginning to fully appreciate. Beyond the complexities of the skull, imagine for a moment that you are slowly going blind in the ancient world. Your world is fading into a grey fog because your lens is clouding over from cataracts, a common condition of aging. Today, this is a routine 20-minute procedure involving lasers and synthetic implants. But 2,500 years ago, it was also a treatable condition. The technique used by ancient eye surgeons was known as couching. The doctor would use a specialised, extremely fine needle. After perhaps applying a mild herbal sedative, they would insert the needle into the side of the eye and carefully push the clouded, hardened lens downward into the vitreous cavity of the eye. This moved the obstruction out of the line of sight. The patient would see blurry images afterward because they no longer had a focusing lens, but they were no longer in total darkness. They could see shapes, colours, and navigate their world again. Historical evidence for this procedure is vast and spans across multiple continents and centuries. In the Kingdom of Babylon, as far back as 1750 BCE, the Code of Hammurabi, one of the oldest legal texts in history, actually mentions the healing of cataracts and sets the fees for such surgeries. In ancient India, around the year 600 BCE, the legendary physician Sushruta described the technique in the Sushruta Samhita with such great detail that it could almost serve as a modern manual. Even in the Roman Empire, around the year 30, the medical writer Celsus documented the entire procedure, from the positioning of the patient to the specific shape of the needle. We have even found the physical tools themselves, specialised bronze and silver needles with fine tips, in archaeological sites and shipwrecked medicinal chests across the former Roman Empire. How successful was it really? Modern ophthalmologists who have researched the historical technique suggest that roughly 1 in 3 to 1 in 2 patients regained at least rough functional vision. For someone who was living in a world of total blindness, this was nothing short of a miracle. It allowed people to return to their families, to work, and to live with dignity. This was not a matter of mere improvisation or luck. The Indian physician Sushruta described over 300 separate operations and classified 120 different surgical instruments. His school of medicine was rigorous. Students did not just jump into surgery, they trained for years. They practiced fine, controlled cuts on the leaves of lotus plants to master depth perception. They worked on water bladders to understand how to operate on hollow organs without causing leaks. They refined their tactile skills on animal cadavers and even vegetables before they were ever allowed to touch a human patient. It was a formal, structured education system. Roman eye doctors were so respected and their practices so established that they even had personal seals, much like a professional brand stamp or a modern prescription pad. These small stone seals were used to stamp cakes of medicinal ointment with the name of the doctor and the specific condition the medicine was meant to treat. Over 300 of these seals have been discovered by archaeologists, bearing descriptions for specific eye treatments and collyrium formulas. This was a specialised and highly respected profession with a clear standard of care. At this point, you might be wondering, with no antibiotics, no sterile operating rooms, and no general anaesthesia, how did they pull this off without everyone dying of massive infections? We often assume that before the 1860s, surgery was synonymous with systemic infection and sepsis. However, we have found that there are four main reasons for their success. First, anatomical knowledge gained through intense practical experience. Egyptian embalmers, for instance, understood the placement of internal organs in precise detail because of their religious practices. Roman field surgeons documented thousands of battlefield injuries and became experts in vascular systems. They learned from both the living and the dead, creating a database of human biology that was passed down through generations. Second, surprisingly clean conditions. What our sile, they did not know about bacteria in the modern sense. They knew what worked. Hippocrates wrote extensively that wine and vinegar should be used to cleanse wounds. Modern laboratory tests confirm that the acidity and alcohol content in ancient wine and vinegar was sufficient to kill many dangerous strains of bacteria. Ancient Egyptian papyri recommend using honey on wounds to prevent what they called rotting. Today, we know that honey is naturally antibacterial because of its high sugar content and low pH. In fact, medical-grade honey is a recognised and effective treatment for wound care in modern hospitals today. Third, the use of sophisticated natural painkillers. We have evidence of opium use in Mesopotamia as early as 3400 BCE. There were records of cannabis mixed with wine in China around the year 200 for surgical use, and the widespread use of henbane or mandrake in the Roman world. In South America, the chewing of coca leaves provided a local numbing effect. These were not the controlled general anesthetics used in modern surgeries, but they were powerful enough to dull the most intense pain and allow a surgeon to work with a relatively still patient. Fourth, systematic knowledge transfer. Medicine in the ancient world was rarely a secret held by one person. It was taught in schools, from the houses of life in Egypt to the famous medical school on the Greek island of Kos. Textbooks were written, copied, and preserved over centuries. This was not luck or magic. It was the result of thousands of years of shared empirical experience. They observed what worked, discarded what failed, and refined their techniques over vast spans of time. Today, we are actually in a period of rediscovering some of this lost wisdom. It is a humbling thought. For example, honey was officially approved by modern medical boards for treating antibiotic-resistant wounds in the year 2007, which is something Egyptian doctors were writing about 3,500 years ago. Maggot therapy, which uses sterile larvae to clean away dead tissue while leaving healthy tissue intact, is once again a standard tool in many modern hospitals for difficult cases. Even the foundation of modern aspirin has its roots in willow bark, which Hippocrates recommended for treating fevers and inflammation in ancient Greece. This history shows us that progress is not always a straight, upward climbing line. In medieval Europe, much of this ancient knowledge from the Greek and Roman eras was actually lost or suppressed. During that period, surgical survival rates dropped significantly and medical practice often regressed into less effective methods before they began to rise again during the Renaissance and the Enlightenment. We are only now fully reclaiming the level of surgical confidence that was present in some ancient cultures. The story of ancient medicine reminds us never to underestimate what humans can achieve with careful observation, repeated experience, and the courage to try. Our ancestors were not primitive or barbarians in the way we often like to believe. They were brilliant pioneers who paved the way for the medical wonders we take for granted today. They worked with the tools they had to solve the same problems we face: pain, injury, and the desire to live a longer, healthier life. They understood the delicate balance of the human body and respected the healing power of nature. What Howison? We look at a 7,000-year-old skull with a perfectly healed surgical opening. We aren't just looking at an artifact. We are looking at a story of a patient who was cared for, a surgeon who was skilled, and a community that supported the healing process. If these journeys into the deep past fascinate you, consider following along for more explorations of human history, and we would love to hear your thoughts. What hours at other ancient knowledge or lost technology do you think we should rediscover next? Are there other mysteries of ancient science that you find compelling?